to be safe for use among the population. The efficacy level is about 63%, and currently we are vaccinating those over 18 years of age. So those who are eligible, I said that and I gave the frontline workers essential services, those over 50 years old, as well as those who have enhanced risk. Those with enhanced risk are those who are living with chronic conditions, and we will have a session where we'll discuss the non-communicable diseases and some of these chronic conditions to enhance your understanding. Also, people over 18 years, I have said that, and you need to provide verbal consent for you to be vaccinated. So that means it is not mandatory. You have to consent. And also, persons, there's also a question about if a person with 19 it can be vaccinated, saying even if you suffered COVID-19 disease and you recovered, you are eligible for vaccinations. Contraindications, what we want to say is that if a person has hypersensitivity to the first dose, we give vaccines across the country, even to children. We do not miss cases of adverse effect following immunization. Those have always been there. But the National Vaccine and Immunization Program is keenly following up on the side effects that are being reported by individuals, even following the vaccinations. So we are taking them seriously and really monitoring in case of any hypersensitivity following the first dose, we will be notified. And also hypersensitivity to the active ingredients of the vaccines. Also, if a person has a known maybe anaphylactic and chicken, that is a contraindication. And we are saying we are taking precautions when giving the vaccines. If a person is severely ill, we will wait until this person has recovered. That means we are just postponing immunizing at that period of time, but until they recover, they can be vaccinated. So in acute illnesses, we are taking precautions for vaccinations. And then people who are having acute phase of COVID-19 infections, yes? A person is suffering from acute phase of infections. We are taking precaution to postpone administration of the vaccine until they recover. We've had a lot of questions about pregnancy and lactations, and we are saying during the clinical trials, we still do not know the adverse effects during pregnancy and lactations. So we are saying if only we weigh the benefits of the potential risks to the mother and also to the baby, attending doctor might evaluate on the case and advise the mother who is pregnant or lactating to get vaccinated. But routinely, we are not vaccinating those who are pregnant and also lactating. Those who have said they got their vaccinations and they do not know on when the second dose is coming, the Ministry of Health has opened a portal whereby you can log in and even download your vaccination certificate. And it will clearly state the next date for your vaccinations. That is currently between it was 8 weeks previously, but as at now, it is 12 weeks. So I've tried to handle most of them. I have my colleague here from the National AIDS and Control Council, Dr. Celestine Mugambi. I will welcome you so that you handle some of the concerns, especially about the COVID-19 vaccine. Welcome, Dr.
So good morning, and thank you, Beatrice, for giving me this chance to speak. I think you have covered all the questions. I just want to talk about the vaccine and those who are under 18, because there are a couple of concerns about why we're not vaccinating children. So, when the vaccine trial was being done, the trials were not done in children under the age of 18. And as at now, we don't know what is the safety profile of that vaccine in that age. And that is why, as a country, and I think globally, except for 1 or 2 countries, we're not giving the vaccine to those who are under 18. But as we continue to do research on the vaccine, then once that is available, we shall be able to give the vaccine. I've seen a particular question about women missing their period after getting the vaccine. I think from our end, that is a new phenomena that we are seeing. I don't think it's a documented side effect. But what I would say is that after the vaccination, if you do experience anything which is abnormal, it is important to visit your healthcare provider as quickly as possible. I'd also like to say that the COVID-19 vaccine does not necessarily prevent you from getting COVID. You can still get COVID infection after vaccination. And a vaccine does not mean that we become lax about preventive measures. Please continue wearing your masks, continue maintaining social distance and frequent hand washing. So the vaccine does not mean that you're never going to get COVID infection. What it does is that if you are to get the of the disease, will be much, much lower. I think those are just the additions that I wanted to make. Thank you very much.
Okay, thank you so much, Dr. Celestine. Sorry, thank you so much, Dr. Celestine, for that clarifications. We are still taking in your comments through the chat box. Keep them coming. For those who have their hands up, please, we may not be able to unmute you so that you speak, but put your concerns on the chat box. If it is burning, you will let us know so that we unmute you so that you talk later. Right now, we are continuing with mental health and psychosocial support in the context of COVID-19. We have experienced a lot as a country since the first case of COVID-19 was diagnosed in Kenya. And we have gone through periods of uncertainties and periods of worries. And a lot of these have brought in some reactions that are not positive. So this is why we are going to talk about psychosocial support, because even adults have been affected with this pandemic as well as the children. So we all need to be in a stable mental state so that we are able to realize our own abilities. We are able to cope with stresses of life, as well as being able to work productively and contribute to the community around you, or even to the families around you positively. We are saying that according to WHO, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease. So putting this into perspective, we know that even if you are not mentally stable, you are not healthy. We appreciate that in any crisis, such as COVID-19 pandemic, it is common for individuals to feel stressed and worried, especially if you feel out of control. And children are not left behind because they are at particular risk of having these levels of stress and worries, especially whatever they are going through, maybe periods of school closure and uncertainties that they are not used to. So we need to take care of what is around us so that we put our mental situations on check. So we are going to participate through our chat boxes. And quickly, I would ask you to write in the chat box, what is the social impact of COVID-19? The social impact of COVID-19 that you are aware of. Kindly give us the responses through the chat box. We will sample some as we proceed. If you have COVID-19, you make people fear you. Thank you for the response. Stigma, job loss, discrimination, separation of families, rejection. Thank you so much for your responses. We are on the same page and the responses are much appreciated. So back to the social impact of COVID-19, we are talking about periods of uncertainty. We have a period where we had a prolonged closure of schools, and this widely affected the learners in a way because most of them considered schools as a haven where they were meeting their peers. It was a safety net for them. And due to that disruption, they were left wondering what next, and some of them got lost in between. Even periods of prolonged stay at home brought a lot of uncertainties and also some behaviors that even up to now we are still working around the clock to sort out some of the issues that came out. Even when schools reopened, I know even you as teachers, there are still so many issues that you are grappling with that were caused by that prolonged period of school closure, as well as. So these are some of the social impact that we must address. The periods of idleness, the periods of feeling the frustrations, the loss of jobs, businesses, loss of income, this affected most parents and guardians. And we are saying the loss of jobs even brought frustrations in families because here is a family head who is not able to provide for the family, and there's nothing they can do, there's nowhere they can go to, and the family is there with you. So as an adult, you also are prone to feeling high levels of psychosocial relapse, fear of disease and death. We have this disease, the period that it came, we still did not know much about it. But as time goes by, we have a lot of researches and studies being done. At least we can say we know the prevention measures and we have a vaccine, but still we are seeing people who are affected and people who are dying. The reality of the disease and loss of our loved ones can also bring a lot of fears and uncertainties. And we know most of us, we can develop coping mechanisms. Some can be positive and some can be negative. So there are those direct effects that we are saying, even me as an individual, I can be affected. This is fear for my own life and fear for the life of my next of kin or loved ones and their safety and well-being. People can be constantly fearing. If you have children who maybe are in schools, if a child is in school and the parents are at home, in both ways, they are fearing for each other, for the safety and the well-being. Fear of illness, suffering, death, even of a loved one, a family member, parent, an extended family, that is bringing a lot of psychosocial issues. There are those who have gone through caring for family members who are sick, who are even, as at now, are still caring for sick family members. There are those who are in quarantine or isolation. Currently, those who have tested positive, like we said in the previous slides, that to test positive, you need to stay in isolation until you recover. So during that period of uncertainty, you might be so much worried about what next. COVID-19 stigma and discrimination is very real. So we need to look out for all these direct effects. Moving on, still on to indirect effects, we have lack of food, other basic needs due to economic effect of COVID-19 at family level. We have seen the direct effect where people lost their job. We are saying this can lead to people going hungry. And as we see, even through our media, the economy has been affected by this pandemic. So all of us may be or are affected indirectly. We have those who have resorted to alcohol and drug abuse. We have those who have been abused emotionally or even sexually. During this period, we have an upsurge in teenage and adolescent pregnancy, and this is something that is trickling down to our schools. We have learners who are coming back pregnant, those who are coming back as mothers and they left as children. So we need to watch out for them and see how to help them. There are those who are forced to undergo female genital mutilations. There are those who went into forced marriages, and also there are those who are just stressed because of constraints in socialization the way they used to be. And for the young children, that constriction, and also they are not able to play as usual and have physical contact with their peers, is also an effect on their psychological status. There is overexposure to the mass and social media, especially among the adolescents. A number of them have been influenced negatively, but we are saying we are here to help them. There are also the stressors on parents and caregivers. There are families who have witnessed violence, victims of violence, those who have gone through both domestic, sexual, or even physical abuse, those who have been abandoned or displaced, applies and even to the adults. Some children sorted out to being employed, child labor, as a way of maybe filling in the gaps in their families. So they stopped going to school, and children also who were forced into marriages at a very tender age. We need to understand these emotional and social needs of these children so that we are able to help them. So as teachers, when they come to our care, we need to see how these children are reacting, because children may express psychological distress in various ways. Some may be acting out. So as a teacher, just look at these children, the way they are behaving. You'll be able to tease out and have a talk with them if they can trust you, so that they let you know whatever that is going on. We are saying all emotions are valid, and such teachers and caregivers need to understand these children and even empathize with them. For the young ones, engage them in interactive activities such as playing, drawing, and this can help these young ones find a positive way to express the disturbing feelings that they may be having. Even back at home, they may be having fears, may be having anger, or even sadness, which they are not able to express. But if you engage them in creative activities, they might find a way of trusting you so that they let you know what is happening. We are saying play therapy is very helpful, so it should be used wherever as much as possible to support the young children who may not be able to express themselves verbally. We the signs and symptoms of psychological distress. Some of these things we may be seeing in our learners. We may see some signs of difficulties in sleeping and eating, lack of concentration in class and other activities. Some learners may become withdrawn, some may become aggressive, angry, or agitated at all times. We have complaining of pain without any physical reasons. They are just sick, maybe headache, stomachache, but no physical reason for these illnesses. There are those learners who may develop fear of being left alone. They are just afraid. And as such, they become clinging and develop depending behaviors. We need to look out for them as teachers and help them. We have those who may have decreased interest in playing and engaging in playful activities. Those others may also become sad. There's no sound. Sorry, there are some of you who are saying they cannot hear, but please check on your internet. We are saying we have those who have decreased interest in playing and engaging in playful activities. Some may manifest by being sad, crying out more than usual, even for no apparent reason. This may be in all the ages from preschool up to maybe lower primary, even upper primary. You have a child who is just sad all the times and crying for no apparent reason. Many of them might regress and start bedwetting. And you find an instance where a child is so much afraid, even if a teacher is talking to them, this child can lose bladder control even in the classroom. So let us look out for these signs and symptoms of psychological distress. When you have a learner exhibiting any of them, please take interest in that learner and help them as much as possible. You might, as a teacher, work out in different ways so that you may have the child trust you, so that they may talk to you and let you know what is happening. The psychosocial support for school children. We are saying we need to give these children the correct information about COVID-19. Teachers, parents should help these children understand what is going on. And we need to help them understand what COVID-19 is, the signs and symptoms, what happens when you are infected, how is it transmitted, what to do when one is feeling unwell, and how it can be prevented. This will help in a large way to address some of the myths and misconceptions that are out there. And these myths can make them become afraid so that they associate this COVID-19 with maybe some monster that is very wild somewhere. So they need to relax once they know the real information about COVID-19. Teachers and parents should also explain to the children that nobody should be stigmatized at all, and even signaling the children. Maybe this child is coming from a family that has been affected by the disease. Please let that child not be shunned or stigmatized just because of COVID-19. So the teachers and parents should explain that to the children so that they know that stigmatization is wrong. When giving the information, keep it simple and appropriate for each child's age so that they are able to understand it better. So for the school response for the psychosocial and mental health issues in schools, we are saying we need to have guidance and counseling sessions, and these should be made available in the schools. Let us have regular group session therapies, and here we are able to offer psychosocial support through having clubs. It can be a psychosocial support club, and this is where children can share their fears and anxieties. We can also have individual therapy sessions whereby you talk to a child individually just to understand what this child is going through. To the young ones, we can tell stories, singing with them, and even playing games, because these children need us as adults. And when we show them love and attention during this difficult time, they can open up to us, and we will understand better what they are going through. Moving forward, still on the school response, we are saying schools can also have peer counselors. These are students or pupils that can be identified by the teachers, and they are trained, given the information that they need to pass out to other pupils. So peer counselors can also be used to pass information on COVID-19 to other students in the same setting. We need to keep to regular routines and schedules as much as possible, as well as time for safety playing and also relaxing. For children in boarding schools, let us keep regular contacts with their families. It can either be via phone, so that they stay reassured that their families back at home are safe. And this will help to reduce the levels of anxieties. Lastly, we need to support the return to school policy for those who have been affected. Let us work together to help these children in one way or another. Referrals for counseling services or psychiatric care. We are saying that some of these psychosocial and mental issues that we identify in our learning institutions, we may not be able to deal with them as teachers. So after identifying, we need to refer these children and link them up for care. We need to identify children with serious emotional and psychosocial needs and link them up to counselors, clinical psychologists, or even psychiatrists for further evaluation and management. We need also to refer for rehabilitation services those who have been affected by alcoholism and drug abuse. We know in our population, even when schools reopened, we have learners who came back having such problems like drug abuse and alcoholism. Let us not shun them, but link them up for rehabilitation services. We have a number of accredited rehabilitation centers that are accredited by NACADA. If we go to the NACADA website, we are able to see which ones are near us so that we refer them appropriately. Also report and seek help for children who are at serious risk for abuse. And this includes children who are facing physical abuse, emotional abuse, and sexual abuse. We will have that session later so that we understand further how we can rescue these children and also help them seek help. We are moving on to talk about social stigma associated with COVID-19. And when talking about this social stigma, we need to understand these three main factors. Number one, that it is a disease that is new and which we are still working round the clock to understand. And number two, there are a lot of unknowns about this disease. So we are often afraid. And lastly, it is easy to associate that fear with others. Comfortable to say the disease of that person, but we need to understand that even us, we can be affected. So we should not point fingers. Let us know that all of us can be affected in one way or another. Again, what may be also fueling the stigma in Kenya is the period when we first diagnosed this disease. We saw how we handled cases that needed to be quarantined or secluded. We saw the way the positive cases were treated, how people were fearing of isolation because it was obvious if you tested positive, you were taken to some center to stay there for sometimes until you recover. We also saw the way dead bodies were handled. Some were given even undignified burials. But we are saying as time is moving on, we are learning so much about this disease, and that is why some of these things have eased. Now we don't take people for seclusion, but we promote even home-based care for those who have turned positive. We will not miss those who are being stigmatized, even in our communities. We have a target population of those who people are pointing finger at, even in the communities. We may have healthcare workers, people who are taking care of these people who are sick in COVID-19 centers. Their families have often been shunned or discriminated against because they are associated with COVID-19 or even spreading COVID-19. So let us watch out for this target population. We help people understand that it is not correct to stigmatize against each other. We have the Chinese. We thought that these Chinese are responsible for bringing COVID-19 into the world. So even if you meet a Chinese on the way, maybe making roads, you are afraid of them, please let us not discriminate against them. If any person can be sick of this, people who are sick with COVID-19 or even have recovered or even a child who have relatives or a family member suffering from COVID-19. There are those who have lost loved ones to COVID-19, and more often we point fingers at them and even label their homes. Hii ni boma ya corona, hawa ni watu wa corona. Please let us not doing that, because that is fueling stigma. People facing pre-existing stigma, we have those who have been living with other conditions like even HIV, AIDS, and other existing conditions. Coupled with COVID-19, people may not even want to go next to them because they now see them as very infectious people. We are saying no, we need to treat people with dignity as much as possible. So the negative effects of stigma are many, and stigma can result in people being insulted, rejected, gossiped about, secluded, and this can drive them to react differently. Some people may react to physical violence, and we have some young ones can even resort to suicide. So stigma can drive people to hide the illness. You are sick, but you are avoiding to come out that you are sick because people will discriminate against you. There are people who are afraid to go to the health facilities. If they are exhibiting the signs and symptoms that we talked about, they may be afraid to go for care just because people will tell them, huyu mwenye alikuwa na kohoa, ako na homa, ana fever, might be having COVID-19 disease. So those are negative effects that we need to watch out for. These people may be discouraged from adopting healthy behaviors, and to the learners or even to the teaching staff, we might have those having absent from school so that people are not talking about them. Absenteeism from work for teachers or even other staffs. We are having those who are facing mental and psychological torture just because of this stigma. So we are talking about this because we need to address this social stigma in schools. And how do we do that? We need to discuss COVID-19 openly and honestly with learners and other members of the school community. Don't assume that the person next to you have the information you have. Give as much honest and effective information as possible to learners and other school community. Do not signal those who have recovered from disease. Let us integrate them back to schools without discriminations. And then we need to support those with symptoms to go for early screening, testing, and treatment. Learners, once they know the signs and symptoms of COVID-19, it is easy for them to point fingers to fellow learners who are having such symptoms. Let us desist from doing that so that we encourage them. Any person with symptoms, let us encourage them to go for early screening, testing, and treatment so that we help them as much as possible. We should have also referral and linkages for psychosocial support in our institutions. And this mainly for those who have lost their loved ones due to COVID-19, so that they are helped as much as possible. So in summary, we are saying we have a vaccine that we can use in addition to other measures that we have talked about. There is a high probability that this COVID-19 pandemic is still continuing, but we need to follow the infection control guidelines that have been given by the Ministry of Health. And that is the most effective strategy that we are going to use to protect ourselves and to protect others from getting COVID-19 infections. So prevention measures starts with me, starts with you as we roll out to others. So let us take care, and most important, follow the infection control guidelines. Thank you so much for listening. That is the end of my presentation. Back to you, Salome, for guidance.
Thank you, Madam Beatrice. Let's take the next presentation that is on HIV and COVID. Then thereafter we'll respond to comments. HIV and COVID will be presented by Jackson Kihima from Ministry of Education. Jackson, over to you.
Hello, are you able to hear me? Or not? Okay. Yes, we are going to continue with the topic HIV and the COVID-19. And first of all, I want us to discuss about this question, and the kindly teachers, I want you to type your response in the chat box. What is the most serious challenge you have faced as a teacher since the closure of the schools in March 2020? What are the challenges that you have faced as a teacher since the closure of the schools in March 2020? And about your learners, what are the challenges learners have shown? A lot of challenges. COVID was declared in our country. Thank you very much for those who are responding. Idleness, early pregnancies, insecurity, so much idle time, pregnancies. Those are some of the responses I'm getting from my side. But to add on that, I want to say that the long closure of the school due to COVID-19 pandemic has exposed both staff and the learners to various negative challenges, such as teenage pregnancies. You remember what happened when there was lockdown. Most girls were involved in sexual activity. Most of them got pregnancy, and according to the statistics that was conducted, it was shown that about 11,000 girls got pregnancy in Nairobi, Kajiado, Kakamega was around 6,000. So the number raised, there was too much. So we have new HIV cases. You understand that most of them are taking risk. They are having sex without using protection. So there are chances that they are what you call STI, sexual transmission infection, lack of psychosocial support, sexual and gender-based violence, among others. And we say that statistics indicate that COVID-19 has more advanced effects to those pre-existing medical conditions, like people living with HIV, since their immunity is already compromised. When we talk of immunity being compromised, we mean that the body is not in a position to fight the virus by itself because they are lacking some protective mechanism to fight the disease. So what do you know about HIV and AIDS, teachers? Let's share our concern. Let's share through our chat box. What do you know about HIV and AIDS? What is HIV? What have you learned about AIDS? Or what do you know about AIDS? Thank you for those responding. And we are saying that it has no cure, it destroys immunity, incurable, no cure, has no cure. Yeah, that is very good. So we are saying that HIV stands for human immunodeficiency virus. And when we talk of immuno, it means that the body is not in a position to fight the virus. or it means that the body developed resistance against a particular antigens or a particular bacteria. And the deficiency means that you are lacking certain things to fight this virus. So HIV affects a person's immune system and the part of the body that fights off germs such as bacteria or viruses. So when your body is not responding to these infections or to this virus or to this bacteria, it means that we call immune system. When a person is infected by HIV, the ability to fight disease and the viruses are compromised. You are not in a position to fight the virus because your body is really compromised. What is AIDS? And we are saying that AIDS stands for Acquired Immunodeficiency Syndrome. Acquired Immunodeficiency Syndrome. And it is the late stage of HIV infection that occurs when the body immune system cannot fight the virus. And immunodeficiency, meaning immunity is compromised or reduced. And with the availability of retroviral drugs, which we call them ARV, AIDS has become a thing of the past. So if you have been infected with the virus, if you have got the HIV virus, don't just sit there. Visit any hospital and they get these ARVs. They can keep you going. You can live many years. I just want to tell my participant today is that HIV is not a killer disease. HIV is not a death sentence thing. It's just you need to manage it by taking the ARV, eating well, doing exercise, and moving on. People have lived with the virus for more than 20 to 30 years. So HIV is not a killer disease. That's why we are saying with the availability of retroviral drugs, AIDS has become a thing of the past. We look at the window period, and we are saying that the window period is a time when HIV infections and the point when the test will give an accurate results. So this will depend that last time you were exposed. For example, if you had sex like 1 month ago or 2 months ago, the test cannot detect immediately that you are positive. You must have been, taken like 3 to 6 months for the test to detect you are positive. And during the window period, a person can have HIV and be very infectious, but still test HIV negative. You can walk with someone to the lab and he tests negative. So, but since the HIV are still in the window, is still in an incubation period, the person cannot detect immediately. So it takes a period of 3 to 6 months for the virus to be detected. So ensure that you do your HIV test regularly because it's one of the prevention methods of HIV. How HIV situation among adolescents aged between 15 and 24 years, 2020. This last year, we are talking of around 1st December to now. The HIV infection among adolescents is at 14,344, which means 2/3 of these are in adolescent girls and young women. You can imagine. So most of our girls are exposed to HIV virus. 42% of all new HIV infections, adult HIV infections occur among the adolescents and the young women. And we are saying that young people living with HIV in Kenya stand at 142,161. So that non-adolescents and young people get newly infected every day, and the 7 young people die every day from HIV-related causes. We continue. Just something that I wanted to mention here is that a person with HIV is considered to have a progress to AIDS when the number of their CD4 cell fall below 200. So the normal value should be between 500 to 1,600 copies. So 42, and again, they develop one or more opportunistic infection. So when a person with HIV is considered to have progressed to AIDS, when they develop one or more opportunistic infections. And when we talk of opportunistic infection, we talk of TB, pneumonia, and others. What are the challenges do you think a person living with HIV faces? Teachers, you can write your response in the chat box. Let's share. What are the challenges do you think a person living with HIV faces? Type your response in the chat box. Yes, we have stigma, we have fear of death, we have stress, stigma from immediate siblings. Thank you for your responses. Sickness. These are some of the challenges to add on what you have just said. Challenges faced by people living with HIV amid COVID-19. We are saying that during the lockdown and the curfew, COVID-19 was not without challenges for people living with HIV and AIDS. So this includes inability to easily reach the medical facility on time. You find that some people could walk a long way to get to the hospital and get medication. Then you change of health facility. You find that this facility was closed down. Maybe a person was found COVID positive. So the facility was closed and the person could walk a long way to get to another facility. Lack of psychosocial support, stigma and discrimination, poor nutrition. Some had to stop taking ARVs due to unavailability. They were not found anywhere, so they had to stop taking them. And then, how is HIV spread? Type your response in the chat box. How is it spread? You can type your response at the chat box. Thank you. Taking ARVs. Sex, blood transfusions. Yeah. Let your response come. Unprotected sex. Body fluids spread through sharing of sharp objects. Thank you. Having unprotected sex and others. We continue. We want to talk about the four main ways in which HIV is spread. And the one we begin by saying that it's through sexual transmission. Without using a male or a female condom, the infected person comes in contact with vaginal fluids or semen or anal fluids of an infected person. Another one is mother to child during delivery or during breastfeeding. We have blood and blood products and organ transplant from an infected persons with HIV. This is a very rare with the screening of blood and organs before it is being transfused or transplanted into another person's body. We have contaminated needles and other sharp objects. A person can get infected with HIV through contaminated needles, sharing of sharp objects, needles, syringes, and other sharp objects. And this includes sharing circumcision knives. These are the information, teacher, that we should enroll to parents and the others who are doing circumcision in our community. Needles, tattooing, or ear piercing with someone who is HIV positive. So those are the main mode of HIV infection. HIV is not transmitted through, this is what I need you guys, teachers, to understand, that it's not spread through insect bites, like a mosquito bite. It is not spread through toilet seats or sharing bathrooms. It is not spread through kissing, hugging, or touching a surface or a person who is HIV positive. It is not sharing food or utensils such as spoons, cups, and plates. Yeah, I was sharing a story yesterday whereby a teacher, I had a teacher had to stop a support staff from cooking tea in the office because the staff just disclosed his information that she was HIV positive to the head teacher. So mwalimu akasema kuanzia leo don't cook tea in this house, in this office. So it cannot be spread through that. I want us teachers to understand that. Sneezes, coughs, sweat and spitting, sharing beds, playing together, sharing pens, using swimming pools together. Those are some of the ways that HIV cannot be transmitted. Let's continue. How do you think the spread of HIV can be prevented? Teachers, kindly type your response through the chat box. How do you think the spread of HIV can be prevented? Thank you. Through sexual intercourse, deep kissing, testing, being faithful. Thank you for that answer. Creating awareness, having unprotected sex, avoiding sharing of sharp objects, green blood before transfusion, faithfulness. Thank you for the responses. They're very good. And HIV prevention, we talk of know your HIV status and that of your partner. It's very key. Ensure that you know your HIV status. Ile tabia wanaume tunangojanga wa mama waende clinic ndio tuseme they are negative, then we rule out that we are negative too. Let's stop that, teachers. So let's ensure that you know your HIV status. You accompany your wife if she's pregnant, accompany her to the clinic. Let HIV test be done and confirmed that you are HIV negative. Because one of you might be a discordant. A discordant is where one is HIV positive, another is HIV negative. And there are chances that you can get this virus. So abstainers, always advocate abstinence for our pupils. Don't advocate for condoms in schools. Yeah, it's because it's against the policy and the policy of the ministry. Always encourage pupils to abstain from sex. Then those in relationships and in marriages settings should be faithful to their partners. Take note of that. Those who are sexually active should use condoms correctly and consistently. That is very important. It is written in black. You can even underline it. Use post-exposure prophylaxis. If you have been exposed to HIV, maybe you had sex without protection, maybe you had a condom burst, or one of you, maybe you don't know the status of your partner, then you go, and you had sex, then you go for this, what we call PEP. It is taken within the 72 hours. So consider pre-exposure prophylaxis for those at risk. When you talk of those at risk, commercial sex workers, truck drivers, long distance drivers, and also discordant couples. So consider exposure prophylaxis, disclosure of HIV status to sexual partners. It's very important. Ensure that you know the status of your partner. Use of clean needles and syringes for the drug inject users. Follow guidelines on prevention from mother to child transmission. So those are some of the prevention measures that we are supposed to take into consideration to protect us from getting the virus. So I want you to know that HIV is real, just like COVID-19. Our facilitator told you that COVID-19 is real. So the same as HIV is real, and you can still get it. I remember our CS used to say that I can get it, you can get it. So take care, wash your hands, ensure that you keep social distance. That is what we want to advocate for. Whether you are HIV positive or you are HIV negative, you must take the precautions to protect yourself from getting this COVID-19. I can tell these are the common myths and the misconception about HIV and AIDS. And I can get HIV by being around people who are HIV positive. Mosquitoes can spread the virus. I can tell if my partner is HIV positive by looking at him or her. No. My partner and I are both HIV positive, so we don't have to practice safe sex. No, you need to practice safe sex. Even if one of you is positive or both of you are HIV positive, the HIV has got so many, there are so many virulent about HIV. So if you sleep with someone who is HIV positive and maybe you are positive, you might have a different strain. And in the process, the virus, your body can develop immune resistance. So make sure that you both use protection whenever you have sex. HIV is a death sentence. No, HIV is not a death sentence. You can still live with the virus for many years without having any problem. And you can tell if someone has HIV/AIDS by looking at them. No, it's not easy to tell whether someone's HIV unless you test, you go for an HIV test. HIV positive people can't safely have children. They can still have children who are HIV negative. HIV always leads to AIDS. No. Those who test negative for HIV can have unprotected sex. We continue. Those are the common myths and the misconception about HIV and AIDS that we need to give relevant information about HIV. So antiretroviral treatments, we call them ARVs, medications. Antiretroviral medications are a powerful life-saving medicines that prevent HIV from multiplying in the body of those who are HIV positive. So if you are HIV positive, to keep your immune system stable and to help your immune system to fight other opportunistic infection, especially during this time of COVID-19, therefore ensure that you adhere to the medication as prescribed by your doctor. Don't even leave a single day. All those who test positive are advised to take ARVs. It's very important. Nowadays, anybody who tests for HIV virus, we advise you take ARVs. Kitambo tungengojea your CD4 you ended below 200. That is when we introduce you. But nowadays, immediately you test for HIV, you introduce you to ARVs immediately. If you miss taking ARVs, the virus becomes stronger and it becomes resistant to the medication. That is very important to take note of. Kindly teachers also give this information to the learners, ensure that their learners adhere to the medication, they keep time, and ensure that they don't skip taking the medication. If you miss this, the virus is resistant, the virus becomes stronger, and your body becomes resistant to medication. Benefits include decreases the virus and also increases the CD4 cells count. Increases the CD4 cells count. I told you the normal CD4 value should be between 600 to 1,600. Reduces the chances of getting opportunistic infections, but also to reduce the risk of transmitting HIV from mother to child. So what is pre-exposure prophylaxis? Pre-exposure prophylaxis is an HIV prevention method in which people who don't have HIV take HIV medicines daily to reduce their risk of getting HIV if they are exposed to the virus. So if you know that you have been exposed, if you maybe you have a girlfriend somewhere and maybe you want to have sex, but you don't have, these are drugs that we use for prevention. It's used for prevention. So PrEP can stop the HIV from taking hold and the spreading throughout your body. And who is eligible? Not everyone is eligible for the drugs. It's only for specific people, persons who have multiple partners, such as sex workers. This is advice for people who are Muslim. Thank you. Sorry for that. Pre-exposure prophylaxis, and we are saying that it's an HIV prevention method in which people who don't have HIV take HIV medicine daily to reduce their risk of getting HIV. PrEP can stop HIV from taking hold and spreading throughout your body. And who is eligible? Persons who have multiple partners. We talk of sex workers, long distance drivers. If the sexual partner is HIV positive or has an unknown HIV status, history of sexual transmitted diseases, STIs, engages in transactional sex, those who inject drugs or young people are eligible for PrEP. Look at the PrEP. Let's look at the PrEP. You have heard about PrEP, teachers? Post-exposure prophylaxis, and it's a short course of HIV medicines that is taken very soon after possible exposure to HIV to prevent HIV transmission. So it is a drug that we use after you have exposed yourself to HIV. You must start within 72 hours after you are exposed to HIV, and or it won't work. So you must start immediately after you have been exposed to HIV within 72 hours. Every hour counts. You take them for another 28 days. So you take them daily for another 28 days. Persons who have been raped or accidentally exposed to contaminated blood fluids should also take PrEP. Eligibility requirements for PrEP exposure. Exposed person must be HIV negative. That is rule number 1. That you must be HIV negative for you to be given PrEP. Exposure happens within in the past 72 hours. This should be within 3 days of your last exposure. And I said that if you go after 72 hours, the drug may not work for you. Exposure is high risk, e.g. blood or bloody body fluids, breast milk, semen, vaginal secretions. Then you start within 72 hours, you continue for another 28 days, then you give entire drug supply. We talk about people living with HIV, they experience stigma and discrimination. And I said earlier, teachers, when you have HIV, that does not mean it is the end of life. These people need support just like you. They need care just like you. So let's not stigmatize these people who are living with the virus. People living with HIV experience stigma and discrimination. And the stigma is a negative attitude towards people who have characteristics that make them different from what people think is normal. So you find that you stigmatize someone because he's HIV positive or he's COVID-19 positive, and then you are like, I cannot be with this person, I cannot sit close to him, I cannot share food together. Those are some of the things that bring stigma. Discrimination describes the actual ways that people are treated worse than others. Ati huyu alitembea vibaya ndio akapata virusi vya HIV, ama unaambia mtoto babako kwa sababu alitembea vibaya ndio ukapata nini? Virusi vya HIV. That is discrimination. Let's treat these children equal. Let's give them love. Let's give them care. Let's protect them against this discrimination. Discrimination against people living with HIV means they are denied their basic human rights. It's not right to deny. They have a right to education. They have a right to basic needs. They have a right to associate with others. That does not mean that they cannot do what other normal people are doing. So they need a lot of care. They need support. They need to be supported in any other way. So stigma leads to people refusing to go for tests because they fear of finding out their status. Nikisikia kwamba so alikuwa anatangazia mwenzangu ya kwamba na virusi vya HIV, hata mimi nitaogopa, sitaenda kupimwa kujua hali yangu ya HIV. So let's not discriminate anyone who is living with the virus. Fear of being judged negatively by others. So if I disclose my status, maybe to my colleague here, I don't know how he will take it, how he's going to tell others about my status. So the fear of being judged negatively by others, fear of losing friends. I don't want to lose friends, so I want to maintain my status. I don't want to disclose my status to anyone. So those are some of the stigma that people leads to people to refusing to go for the test. Yeah. But it's good to go for the test. Just ensure that you know your HIV status. When you know your HIV status, that means that you value your life more than anything else. And therefore, your body, even if you test HIV positive, we will put you on medication. So it is not a death-sentence thing. Should we care for people living with HIV? Teachers, you can write your response through the chat box. Should we care for people living with HIV? And what kind of care should we accord them? What kind of care should we accord these people who are living with HIV? You can type your response through the chat box. Let's continue sharing our experience. Showing them counseling, giving them counseling, loving and supporting them, medical support, show them love, moral support, giving them, thank you. Yes, they need your care, our care, yeah. So these are some of the responses I'm getting from the chat. Care and support for people living with HIV. Persons living with HIV are likely to be more adversely affected with COVID-19 since the immunity is weak. Such learners should be given extra support and care. And when we say support and care, this includes check their medicines they are taking. It's very important. Always check the medicine they are taking, read the instructions to find out when they need to take them, what kind of food they need, and any other side effect. So that is very important. Relevant medical advice and support should be provided in close collaboration with the parents or guardian and medical personnel. So let's identify a teacher who will be responsible maybe in giving drugs to these learners. For example, it can be a nurse, can be a counselor, or someone who cannot disclose information of learners to others. Relevant medical advice, those on ARV should be supported to ensure full adherence. It should be supported to ensure full adherence. Psychosocial support, guiding and counseling. Spend time with the person living with HIV and AIDS. Especially during this time, people have gone through a lot. Some do not have food. Some have no money. Some have no clothes. So you as a teacher or as a guardian, you have a responsibility to play. Yeah, it's sharing love. It's part of sharing love, sharing care and support to these people living with HIV. Nutritional support, get to know what kind of food they need. Sio tu kukula githeri kutoka Monday mpaka Friday. Sometimes you need to understand this person needs this kind of food. Then finally, I want you to remember this. There is life after testing positive for HIV. And I've talked about that. having the HIV virus is not the end. It's not a death sentence thing, just a condition that you need to control, take medication and live like another person. Confidentiality is key. When you get information that a learner is HIV positive, it's not a matter to discuss in the staff room about the learner and the parent. Keep confidential information regarding people living with HIV. It's very important. And it's against the law. When you find out that someone has linked the information about my health, you can be taken to court. And HIV testing services are available for free in all the government hospitals. Ensure that you seek for one. Know your HIV status, very important. Do not blame or accuse children regarding behavior of parents or relatives. Schools should not discriminate against lecturers or learners, teachers or staff living with HIV. So the school should not discriminate anyone because of their HIV status. With ARVs, persons living with HIV are leading normal lives. Children living with HIV cannot transmit the disease to others. So let's ensure our learners adhere to ARV schedules to avoid losing them to COVID-19 or other opportunistic infection. Thank you very much for your time, and have a wonderful afternoon. Back to you, Madam Salome.
Thank you, Mr. Kihima, for the good presentation. There are many issues being raised on the chat box. Kindly let's respond to them. The trainers, kindly respond to the issues raised on the chat box before we move to the next presentation. You can respond to from the chat box.
Thank you so much, Salome, and thank you, Jackson, for that informative presentation. Hello. We are proceeding to take some of your concerns that you have been posting on the chat box. And thank you, Jackson, for the presentation. So some of the concern about PrEP, there were questions whether PrEP is available over the counter, whether maybe to elaborate more on side effects of PrEP and cases where, are there cases where HIV does not lead to AIDS? And in case of misdiagnosis and you are put on ARVs, what are the negative effects of taking ARVs when you are negative? Also, what is transactional sex? Maybe we could have a person from NAC or assist in answering those questions.
Okay. Thank you very much, Jackson, for the good presentation. I've heard the questions. I think we have typed in what is transactional sex in the chat box. It is basically sex where we expect an exchange of money, services, food, or something else to happen. So in the case of, for example, a female sex worker, she'll be having sex for money. In the case of what we normally hear, can you hear me now? Am I back? Yes. Okay, apologies for that. So I was saying transactional sex is where we expect goods or services to exchange hands after sex. So for a female sex worker, for example, it's going to be exchange for money. The cases we normally hear of young girls or young learners in the university, sex for grades, that is an example of transactional sex. There was a question about the role of understanding HIV and AIDS in the COVID-19 pandemic, and I'm sure a lot of you are asking, why are we talking about HIV during times of COVID? For us, we're coming from the perspective of the risk factors of acquiring new HIV infection. You've been told the modes of transmission, but the risk factors really are fueled by gender inequalities, fueled by poverty, fueled by lack of education and economic empowerment. And if you look at what the COVID situation has done to the country, it has done exactly that. People have lost jobs, so there's loss of livelihood. Young people have been at home. A lot of people are very idle, so a lot of them not being engaged. We've also had poverty actually increasing. A lot of gender-based violence actually has been reported. So all of these things actually are fueling our HIV epidemic, and that is why we are covering them, so that even as we prevent COVID, then we're very intentional about preventing HIV infections. Now, questions about PrEP and PEP. I think the presenter has covered it very well. PrEP is given to those who are at continued high risk of getting HIV infection. And so we don't normally categorize them into populations. But if you're at high risk, for example, you've been told that the truck drivers, the female sex workers, or you keep on coming with recurrent STIs, then you become a very good candidate for being given PrEP. PEP is normally given after the exposure, after the sexual act has actually happened. If you had a condom burst, if you are not aware of your partner's status, or if you've actually been raped or sexually violated, then you're a candidate for PEP. I want to stress that all these ones are given in a health facility. They are not to be bought over the counter, because we have to do a lot of counseling and we have to do a number of tests before we actually put you on the medication. Depending on how your body would respond. So those are the side effects. Are there cases where HIV does not lead to AIDS? Yes, and that is why Jackson talked about everybody who tests HIV positive being put on ARVs, because we want to avoid the natural progression to AIDS, which is basically what we call end-stage disease. It was very common in the 90s, but now because we are doing what we call test and start, you start on ARVs regardless of your immunity, then we are seeing less of those cases coming. There was a question about, can I get HIV from oral sex? Yes, you can. If there's a mixture of blood, if your partner has got sores and you've got sores in the genital area or in the mouth, then that is possible. There's also questions about deep kissing. How does deep kissing, can it cause sex? And yes, what is deep kissing? If your partner or if you have got open cuts, open sores in the mouth, yes, you can actually get HIV because of the blood mixing. However, saliva is not a very good carrier of the HIV virus. So it's important for you to know that. There's a question about how a mother, I think, who's HIV positive can give birth to a HIV negative baby. We normally recommend that all pregnant women go for antenatal, at least 4 during the course of their pregnancy. And during the first one, we always test the mother for HIV. If she's found to be HIV positive, then we put her on ARVs as soon as possible and also give her drugs for her child. We propose that she delivers in a health facility so that we're able then to monitor her viral load. And as soon as the baby is born to a HIV positive mother, we normally put the baby on ARVs, syrup. And this baby is going to be on ARVs until the time they stop breastfeeding. What is the recommended time for a mother who's HIV positive to breastfeed? We say you breastfeed for as long as possible, just like any other normal woman. For the first 6 months, you do exclusive breastfeeding, and then you actually breastfeed for as long as you. Can you hear me now? Okay, so I was talking about breastfeeding. So for as long as the mother is breastfeeding, she's on ARVs, and the baby also is full. So it is possible for a mother to transmit HIV to her child during breastfeeding if she's not on ARVs herself and has got a very high viral load. if the baby also is not covered with ARVs. So I think I have covered all the questions, but there's one I wanted to address. Can a teacher tell a learner to have protected sex if they cannot abstain? And I think the Ministry of Education policy is very clear that we do not encourage within the school environment for the learners to use condoms. However, we don't live in isolation. If you feel that you've got a particular learner who is at risk, what you do is you liaise with the school administration to actually refer this child to a health facility for counseling, and then the proper information is given to this young learner. So that is what I would say. What's the difference between commercial sex and transactional sex? Commercial sex is part of transactional sex. A long time ago, we would say that for as long as you're exchanging money, then there's a problem. But you see people normally exchange sex for very many other things, for house rent, for food, for grades. So it's all called transactional. For as long as you're expecting something from your sexual partner, then we call it transactional sex. Thank you very much.
Thank you so much, Dr. Celeste, for that elaborate response. We had given the response on COVID questions after break, and so we will just continue with the next presentation.
And the next presenter is Madam Beatrice Ochieng, through the non-communicable diseases and COVID-19. Welcome, Madam Beatrice.
Thank you so much, Madam Salome. We are proceeding with the presentations, and we are now going to talk about the non-communicable diseases in the context of COVID-19. And what we are saying is that we need to know more about these non-communicable diseases because as a population, even in the school community, we have both learners, teachers, and even the non-teaching staff who are living with these non-communicable diseases. So in the context of COVID-19, we need to understand and know what advice to give them and the management that they are supposed to get. So what are non-communicable diseases? We are going to have an interactive session, and kindly, could we give some examples of the non-communicable diseases that we know? Let us respond through the chat box. Cancer, diabetes, thank you for participating. Blood pressure, hypertension, BP, thank you so much for those responses. We need to understand what these non-communicable diseases are, and we are saying these are diseases that do not result from an infectious process, and they cannot be transmitted from one person to another. Most people without underlying non-communicable diseases, when infected with coronavirus, they experience mild to moderate respiratory illness, and sometimes they recover even without needing specialized treatment. People with underlying non-communicable diseases are at higher risks of developing severe forms of COVID-19 disease, and most of them can even end up in death. This is why we are talking about this as a topic on its own, so that we are aware that if a person has an underlying condition, let them take precautions so that they are not infected with the COVID-19. We are saying this is because they have more severe COVID-19 infections and have higher case fatality rates. Talking about the non-communicable diseases, the responses you have given in the response chat are correct, and we are summarizing it in this chart. We are saying these are the most common non-communicable diseases in Kenya. And when we talk about non-communicable diseases, as I have said, they're also referred to as chronic diseases. We have them for a long duration, and there is slow progression of the disease, and these diseases cannot be transmitted from one person to another. A few examples that we are going to look at are diabetes, cancer, chronic respiratory diseases, as well as cardiovascular diseases and mental health issues. So when we say diabetes, we mean this is a long-term condition that causes the blood sugar levels to rise, maybe either because there is an inadequate production of insulin in the body. Here we are saying the body is not able to regulate the blood sugar levels as it is supposed to. So we have instances where the blood sugar level can rise. Cancer, we are saying a condition in which the body cells in a given part of the body grow and reproduce uncontrollably. We know in our communities or even families, female who have been suffering from breast cancers or cervical cancers. In the male, we have prostate cancer. We even have children who are living with cancers. What we are saying is that cancer is not a death sentence. If diagnosed early, the person can recover and live a normal life as possible. But there are those who are still on treatment for cancer, those who are still getting chemotherapy, radiotherapy, and all those. There are those who even have undergone through some surgeries. So we need to let them know that they need to take special care so that they don't get COVID-19 infections. There are those who are having chronic respiratory diseases, and here we are talking about bronchitis, we are talking about asthma, we are talking about chronic obstructive pulmonary diseases. These people also need to take precautions so that they do not get COVID-19. Malnutrition, when the level of minerals, vitamins, and other nutrients is inadequate in the body. We usually just talk about undernutrition. For mainly, if you talk about malnutrition, people think of undernutrition, but we are saying even overnutrition is also classified as malnutrition. Those with obesity are at risk of getting non-communicable diseases. The cardiovascular diseases, this is a general term that is used to refer to diseases that affect the heart and the blood vessels. And we have diseases like hypertension, that is the high blood pressure, those who have stroke, and the heart diseases. Mental health issues, this is a person's emotional, social, and psychological well-being, and we have discussed at length about psychosocial issues and mental health. So all these are some of the non-communicable diseases in Kenya, and we have people in our population who are living with them. So we want to talk about factors that are associated with these non-communicable diseases that we have said, and we have a number of them. We have these ones that we can see in this chart, like physical inactivity, obesity, raised cholesterol, decreased vegetable and fruit intake, that is taking healthy diet, raised blood glucose level, alcohol use, and tobacco use. Some of these risk factors, the ones we have mentioned here, the beauty is that they are modifiable. There is something you can do about them so that you prevent yourself or others, or tell others about them so that they know that they can prevent getting these non-communicable diseases. We also have other risk factors that are non-modifiable, and those are like age, gender, race, and family. Okay. Thank you. We are going to quickly look through a few of these non-communicable diseases so that we understand what can we do in case we know of a staff member or an staff member or a learner who is living with them. So first, we are talking about diabetes control measures in the context of COVID-19. Here we are saying there might be learners and staffs that are living with this diabetes. We need to ensure that they practice good blood sugar control during the COVID-19 pandemic, as it may help in reducing the risk of infection and severity of COVID-19 should it occur. So let us stress to them the importance of them working towards keeping, having good control of the blood sugar, as well as using other preventive measures so that they are not exposed to COVID-19. We have portable digital blood sugar monitoring machines that people who are living with diabetes can buy and use at home, even in schools. And this can help them monitor their blood sugar levels at home and even in schools. In the absence of that, let us encourage them to visit the nearest health facility when necessary. Also, we are saying we need to go for diabetes screening in the nearest health facilities, even if you have not been diagnosed with diabetes in the past, so that you are in control of your health. Counseling on healthy diets and physical inactivity, we have seen this at some of the risk factors that predispose to this condition. So we need to counsel them on healthy diets and physical activity. Let them optimize the current therapy as much as possible, and if appropriate for the learners, especially those in boarding school who must use the medicines while they are in schools, let them have adequate supply of the essential drugs, even up to 3 months supply of the drugs that they might need to use. And then let us take precautions against discontinuation of therapy without consulting a healthcare provider. We need to work together with these learners so that at one point or another, they might not discontinue their medications without consulting a healthcare provider. When they run out of their supplies, we need to advise them to go for refills at the nearest health facility. This is a picture showing us the blood sugar testing machine that is available. As I have said, it can be used at home or even in schools. If you don't have it at home or in the school, please utilize the nearest health facility. Next, we are looking at cardiovascular diseases, where we have hypertension, have those who have suffered stroke, we have those who are having diseases. So this is associated with increased risk of severe COVID-19 and even associated death. In case you experience COVID-19 symptoms, please visit care facility as soon as possible. There are digital blood pressure machines that exist, and these ones, we can use them to monitor the blood pressure at home or even in schools. But in the absence, if we don't have them, let us not keep those who have high blood pressure without being monitored. Let us send them to the state facility when necessary for them to have the blood pressures monitored. But we are saying keep them as much as possible from getting exposed to COVID-19 because the chances of developing severe disease and even death is high. This is a picture showing a digital blood pressure machine that we can use. The beauty is it is configured that you just touch a button and it gives you the reading. So the learner or the staff can be trained on how to use it and how to monitor the pressures and know when they are normal and when they are not normal. Okay. We are proceeding to talk about cancer. And like any other non-communicable disease, we have people living with cancer still on treatment. And they are also at risk of developing severe COVID-19 infections and also at risk of death from COVID-19 in case they are infected. So they also need to work as much as possible so that they do not get infected with COVID-19, because that will cause, they will experience progression in case they get infected. So they are likely to experience severe symptoms or even die from the infections. So what are we saying? That all these non-communicable diseases are somehow related, because we have to use medications for a prolonged period of time, and we need to be seeking medical attention and being reviewed by the healthcare providers as usual, so that we do not take the matters in our hands, but we make sure that we link the people who are affected as much as possible for care so that they are helped. On top of taking their medications and getting the management that they require, taking the precautions that we have talked about to prevent them from getting exposed to COVID-19, because we have seen that they are at an increased risk of severe disease and also death. Lastly, we are looking at people living with sickle cell disease. This is also a serious illness. And these people, when exposed to COVID-19, they develop severe COVID-19 infection and even death. So let us advise these people to follow general guidance on risk reduction, including social distancing, cough hygiene, and even hand washing, among other containment measures that we have talked about. Strictly avoid contact with someone who is displaying symptoms of coronavirus, and even having high temperature and experiencing new or continuous cough. We need to advise these people with non-communicable diseases to avoid contact with anybody who is experiencing any signs and symptoms of COVID-19. And if possible, they should not leave home unnecessarily. They just have to leave home when it is very necessary, but let them adhere to the given protocols so that they avoid getting infected. So COVID-19 pandemic-related disruptions of prevention and treatment services for non-communicable diseases. What we are saying is that we experienced a period whereby people were afraid of going to the health facilities to seek treatment, just because the health facilities were associated with COVID-19 virus transmission. But we are saying that as a government, most of the routine and elective services, including the non-communicable diseases treatment services, are there, and they are being provided in all the health facilities. There is a guideline that is ensuring continuity of all those services, and they are being offered in the health facilities. So make sure who are having this condition for care and for continuing the health facilities. Learners and members of staffs who are living with non-communicable diseases are also encouraged to continue visiting these health facilities to access the available care that they need. So in conclusion, we are saying non-communicable diseases increase the severity and likelihood of death when a person living with any of these non-communicable diseases gets infected with COVID-19. So persons living with non-communicable diseases should exercise greater precautions to avoid contacting COVID-19. And as teachers, we have a big role in educating learners and members of the staffs living with non-communicable diseases on the risks that they have when they contact COVID-19. It is also very important to continue with the non-communicable diseases medications and care and management as often as possible, especially during this COVID-19 pandemic. That is the end of my presentation. And from this presentation, we have seen that the people who are living with non-communicable diseases are at a higher risk of developing severe COVID-19 infections and even at risk of death. So the questions that majority of you were asking, if people living with non-communicable diseases can be vaccinated, we are saying yes, just to help enhance the protection, because we have seen in case you get infected, you are at a higher risk of developing severe disease and even dying. So thank you so much for listening to us. We will proceed with the other presentations. Back to you, Madam Salome.
Thank you, Madam Beatrice. Your presentation was very educative and clear, as we can see from the comments from the schools administrators and the teachers. We still have some time for the next presentation. Teachers, let your comments come through the chat box, your questions. We are expecting questions, observations, comments from you. Let them keep coming as we invite Madam Salome Gashina, who is an official with Ministry of Education. She will take us through sexual gender-based Salome.
So thank you very much. I take this opportunity to welcome you to the session. Sexual gender-based violence amid COVID-19. And this is one of our area that we've really been affected amid COVID-19. And therefore it is important to go through it. And for us to be able to start, I would want you to type in the chat some of the examples of gender-based violence you have about, you could have seen it unity, and sometimes you could just have had out. So we could take just a minute and type them on the chat. Please type them in the chat. Rape, emotional abuse, abusive language, killing of a partner, sexual abuse and rape, murder, violence, verbal abuse, amputation, beating, FGM, molestation, economic violence, wife beating, silence, psychological abuse, indecent touching, we have FGM, drug abuse, psychological torture, domestic violence, defilement. Thank you very much. Keep typing. Thank you very much for your responses. So some of them could have read about them, others would have even have handled with people. And we are saying as part of introduction that ever since the COVID-19 was first detected in Kenya in March 2020, we have had very sad news from the media on sexual gender-based violence. And most of them we have had chilling experiences of SGBV, and this include what you have typed plus incest, the many teenage pregnancies we have had even among our learners, teenage to teenage sexual acts, defilement, among others, plus what you've already typed in. So children are inherently vulnerable when caught up in traumatic experiences, and children naturally tend to depend more on adults' protection. So when they are going through sexual gender-based violence, and especially from adults, then that becomes very, very traumatic, and they are affected psychologically, emotionally, and even in their behavior. Therefore, it is important for us to understand what happens and also be able to help them, as we are also having these very many cases in our schools. So if we were to define very simply what sexual gender-based violence is, we would say it refers to any acts or threats of physical, verbal, sexual, or cyber violence that mostly may take place in school. Sometimes it may take place on the way to school, during school trips. At times it can even take place at home and within communities. So there are acts of threat that threatens the physical well-being. Sometimes it can be verbal, sexual, psychological, and we also have the cyber violence. My colleague will be talking about online, and again we are saying with cyber, with the increase of use of online, then cyber safety, online safety is very, very important. We have had a lot of learners being abused. So the cyber violence, again, is part of the gender-based violence. So when that happens, what are some of the effects of sexual gender-based violence on our learners? So I would also give you another 1 minute to type in the chat. What are some of some effects of sexual gender-based violence? What exactly happens? What are the effects on our learners? Can type them on the chat. Problem with my chat box. So plus what you have typed is that we have these negative effects of GBV, and this includes low motivation. You may find that a learner who was very motivated, the motivation has gone. In some cases, we would also have absenteeism. Child has been raped, but they can't come to school because of shame. Poor academic performance may also be experienced. We also have early school withdrawals, poor health, early pregnancies and unsafe abortions, depression and low self-esteem, among others, plus what you're putting in the chat. Then we're also likely to have more long-term consequences, which may include trauma. This could be psychological trauma and also the physical trauma. And people who have gone through SGBV are likely to go through this traumatic, it's a traumatic experience, so they go through trauma. They may withdraw. We may have people who are breeding. Okay. We may have people who are breeding violence. There could be hatred, fear of either male or female. There could also be inability to concentrate. In the chat, we had also talked about suicide, low self-esteem, sometimes death, early pregnancy, drug abuse, loss of self-esteem and poor performance, lack of conversation in learning, and it may also lead to early pregnancies. That's from the chart. Lack of concentration, they may contract diseases, we may have truancy, trauma, emotional distress, lack of trust, school dropout, violence, depression, lack of concentration, issues of mental health, rebellion, withdrawal, dropping out of school, issues of HIV, stress, early marriages. Thank you very much. So what do we need to do then? We would need to have child protection to protect our children from the sexual, gender-based violence. And this is our responsibility as a teachers, even as parents. So parents need to get this information. And when we talk about child protection, it entails safeguarding of safeguarding children from abuse, neglect, exploitation, violence in schools, both at home and also in the society. So it's safeguarding them from this form of abuse. Sometimes children are neglected. We need to protect them from that. Exploitation of whatever nature, violence, and this can take place. This protection should be done both from home and also in the society. So the UN conventions, the Kenya Constitution, and other various laws provide for the protection of children. Children protection helps children to learn, develop, receive quality education right from childhood through young adulthood. So when children are protected, they're able to learn, they're also able to develop, and they also are able to receive quality education without interruption right from childhood all the way to young adulthood. Learners should be safeguarded against all form of violence and neglect when they're in their school and when they're also out of the school to enhance child-friendly environment. So, and this is where we were saying it is important to work with the other stakeholders so that even when children are not in, when children are not in school, out there, they are also protected. Then how do we, which are the legal protection of victims or survivors of SGBV? We have some legal protection on that, and we are saying that the government has put in place various legal framework that protect SGBV that may come from private or a public setting. So this can happen either at home, in school, or even out there. So we have the Constitution of Kenya, and it talks about the right to safety. We also have the Basic Education Act, really emphasizes on child protection and safety. The Children's Act also talks about that. The TSC Act, the Sexual Offense Act, which spells out heavy penalties for sexual offenders. We shall be looking at that. And we also have the Penal Code. The TSC Commission Act prohibits teachers from having sexual relationships with learners and displaying pornographic material. So teachers, we have a responsibility, and the community at large to take care of our learners. So the Code of Regulations and Code of Ethics, the public officers and they are contained in the Service Commission Act. I'm back now. Oh, thank you. Sorry for that. Okay. Sorry for that interruption. Yeah, so the procedure to be followed in case of breach of, so we are talking about the Code of Regulation and Code of Ethics, that is the Public Officers Ethics Act, and it stipulates the procedure to be followed in case of breach of discipline, and these are contained in the Service Commission Act and the Public Officers Ethics Act 2003. And it says that a public officer shall not sexually harass a member of the public or a fellow public officer. In subsequent sexually harass, it includes doing any of the following. If the person doing it knows or ought to know that it is unwelcome. So the first one is making a request or exerting pressure for sexual activity or favors, or making intentional or careless physical contact that is sexual in nature, or making gestures, noises, jokes, or comments, including injurious regarding another person's sexuality. So this is against the law. We should not do that to each other. So it's against the law, even when people are teasing each other in the staff room, you know. Then the TSC Act 2012 prohibits teachers and public officers from having all forms of sexual violence against the learners. So it spells out clear measures of dealing with GBV cases. In Section 22, it prohibits sexual relations with learners. Section 23 prohibits sexual harassment of members of the public, so we shouldn't do that. Section 24 prohibits sexual harassment of fellow staff with our colleagues. And Section 24 also prohibits the displaying of pornographic material. And teachers, we know this is a very serious offense that may even lead, sometimes it leads even to dismissal, or it has led to dismissal. So this is important that we remember as part of our SGBV. So we shall take another 1 minute and type on the chat, who are the abusers? Who are these abusers that abuse our children or can abuse also the adults? We'll take a minute and have it in the chat as we continue. It's not visible. Oh, okay. That's okay. Okay. Thank you. So we are saying from teachers, from relatives, from close relatives, from family members, parents, close relatives, from the members of the public. It can be anybody. We also have teachers, parents, members of the community, parents, friends. It can also be from strangers, some teachers, relatives, men mostly, neighbors, caregivers, strangers, parents, students themselves, mostly people that are known to the victims. It can also be any person for the responses. Let them keep coming, the border riders, public majorly, strangers, people with perceived power over the others, domestic workers and caregivers, siblings. Let the answers keep on coming, so plus that. So what I would want us to note here is that the strangers account for only 6% of GBV. Like most of us have said, there are people who are known to a teacher, a brother, a father, an uncle. Strangers account for only 6% of GBV in Kenya, and 64% of survivors of violence reported that the offenders behind the ordeal were known to them. So this is a study that was done, and it revealed that for people who had been abused or they were survivors of violence, 64% of the people, of the offenders behind their ordeal were people that they are known to them. So it will happen from people that are known to the learner or the staff, you know. According to the Kenya Demographic and Health Survey of 2014, it revealed that 45% of men who are aged between 15 to 49 had had an experience of physical violence since the age of 15. And you know, this age for 15, these are our learners. While 44% of men aged 15 to 49 had also experienced physical violence since age 15. So this is telling us that issues of abuse, physical violence or other abuse start very, very early. The same survey also revealed that 40% of women and 27% of men had sought assistance from some sources to stop the violence they had experienced. So more women are sought for help than men. But it is, since the effect is the same, it's always good to encourage both genders to seek for help in case this happens. So we had done schools, and we're saying school can also happen in other public areas. So at home, like you put in the chat, you can have parents, sometimes the adult relatives, the house help, the neighbors, the farm workers, the fellow children, including their siblings, family, friends, and visitors. So these are people who are likely to abuse the children at home. In school, we may have the teachers, the caregivers in the school, sometimes also the school workers, including the non-teaching staff, the temporary hired workers like the construction workers in the school, fellow learners, classmates, people who are exposed, who learners are exposed to during the school functions in and outside the school, like when we have the drama or the music or the symposium, either in the school or outside school. So such people could also abuse children. In other public areas, it can also happen with the authority figures. For example, the police officers, with the chief, employer, employee, with the religious leaders, sometimes with the medical staff and teachers, matatu and boda boda operators, the neighbors, the shopkeeper, strangers, other children who could be older, relatives, the coaches, sometimes even the swimming pool coaches, or even sports, other people who interact with the children freely while they are playing. So we are saying abuse can happen, and therefore it is important to sensitize the children and also the parents on this, so that as they have the life skills of negotiation and assertiveness, then they can actually know what to do, because this can happen. And when it happens with the authority figures, or most of the time, is that it is under threat, and therefore that is why sometimes you find that they may not even report. So it is important they are sensitized, and even the importance of reporting, as we shall see as we continue. So in case there is a person who is a survivor of GBV, what should we do, either in school or out of school? We are saying we need to ensure the safety and the protection of that survivor. Usually it might have happened at a threat, so they are feeling quite unsafe, they are feeling unprotected, so we need to ensure that they are safe and they are protected. We also need to preserve all of the evidence at site, including the non-removal of the clothes. Most of the time we want to quickly remove clothes and wash the person, but we need to preserve this. When we wash the clothes and remove them, then we are not preserving the evidence. So it's important to preserve all evidence at site and removal of the clothes. The child should not be washed. Should the clothes be too soiled and the survivor needs to change, the clothes should be wrapped in a well-aerated material, not a polythene bag. And this will help to preserve the evidence. Alert a teacher, a confidant, or a friend immediately it happens, whether it is within the school setting or out of the school. Remember, we have said it can happen out of the school, so it's good to alert either a teacher, it could a confidant, or even a friend. It's also important to visit the nearest hospital and inform them of the occurrence. The medics are able to assess the extent and also the type of abuse. And this is important to ensure that they also receive medical attention within the soonest practicable time. Jack talked about HIV, talked about the PrEP. So it is important when we take them, when we report to the nearest hospital, then in terms of HIV prevention, they're able to do that. If they're able to, at the hospital, if you are able to, at the hospital, share contacts of the parents, the guardian, or the confidant. This will help in assisting that survivor forward. Try and share any necessary information that may assist the law enforcement. It could be in school and the teacher has some information on this recurrent abuse. So it is important that this information is shared. Remember always that it is not the child's fault. So it would not be right to harass the child. Ni wewe ulichelewa, unavaa vibaya, unachekanga na boys. You know, all those things that sometimes we are likely to tell them. So remember that it may not necessarily be, it was not their fault to go through that form of abuse. All actions must be taken as soon as possible, preferably within 72 hours. Additional visits with the health. However, even if the 72 hours have elapsed, it's also important to visit the health center, and it's also good to report to the law enforcers. As we shall, in every police station today, we have a GBV desk. So after the hospital, it's good to also report so that the legal procedures are taken.